understanding analgesic medications, a structured approach. Hi everyone, my name is Mersha. Welcome back to Nursing and Me. In today's video, we're going to dive into analgesic medications in a more structured way. We'll group medications that share the same mechanisms of action, side effects, adverse effects, indications, and contraindications to help you better understand their similarities and differences. Before we begin, let's quickly define these terms to make things clear for you guys. Mechanism of action explains how a drug works in the body to produce its effects. Side effects are common, often mild, unintended effects of a medication that are usually manageable and expected. Adverse effects are more serious, harmful effects that can potentially require medical intervention. Opioids are divided into four main groups based on their receptor activity: mild agonists, strong agonists, agonist-antagonists, and antagonists. This grouping allows us to understand how medications in each category work similarly, making learning easier. Mild agonists include codeine and hydrocodone. These drugs bind to opioid receptors to alter pain perception and suppress cough reflex. They can cause severe respiratory depression and allergic reactions, as adverse effects and common side effects include constipation, nausea, and sedation. These medications are used for pain relief and cough suppression, but should be avoided in cases of hypersensitivity and liver impairment. Strong agonists include morphine, hydromorphone, fentanyl, meperidine, methadone, and oxycodone. They potently bind to opioid receptors, altering pain signals in the central nervous system. Adverse effects include respiratory depression, hypotension, and dependency, while side effects include nausea, vomiting, and constipation. Agonists-antagonists include nalbuphine and pentazocine. These drugs act as agonists at some opioid receptors and antagonists at others, reducing abuse potential. Adverse effects include severe respiratory depression, and side effects include dizziness, nausea, and sedation. They are used for moderate pain management, labor pain, and preoperative use, and are contraindicated in hypersensitivity and opioid dependency. Antagonists include naloxone and naltrexone. These medications block opioid receptors to reverse opioid effects. Adverse effects include acute withdrawal symptoms in opioid-dependent individuals, while side effects include sweating, agitation, and nausea. Naloxone is used for reversing opioid overdose, and naltrexone is used for long-term management of opioid or alcohol dependence. They are contraindicated in hypersensitivity. NSAIDs, by the way they pronounced as NSAID, which are used to manage pain, inflammation, and fever. The drugs include celecoxib, ketorolac, indomethacin, naproxen, and ibuprofen. They work by inhibiting cyclooxygenase (COX) enzymes, reducing prostaglandin synthesis and inflammation. Adverse effects include gastrointestinal bleeding and renal impairment, while side effects include stomach upset and dizziness. Non-opioid analgesics include acetaminophen. This medication inhibits prostaglandin synthesis in the CNS, primarily relieving pain and fever. Adverse effects include severe liver toxicity and overdose, while side effects include rash and nausea. By grouping medications, we simplify the learning process. Medications within the same group share similar mechanisms of action, side effects, adverse effects, indications, and contraindications. This approach not only saves time, but also enhances understanding when managing patient care. That wraps up today's video. I hope this new structure helps you understand analgesics more effectively. Let me know in the comments if you'd like similar groupings for other medication classes. Don't forget to like, comment, and subscribe to Nursing and Me for more healthcare education. See you next time. Stay healthy, everyone.